Hi, how you doing? So today let's talk about the risks involved with dental implant treatment. My name's Gus, I'm a cosmetic and implant dentist. We've been placing implants for a really long time now, and we know a thing or two about the risks involved. Now, to break this video down and to keep it kind of short, I've kind of categorized it in a few kind of broad categories. Our first category is our short-term risk. What can happen in the first few weeks or months that can be unexpected? What problems can we face then? Next, we've got our long-term risks. After the initial healing phase of a few months is over, usually implants are pretty stable, but not always. What can happen in the long term with our dental implants? And then the third risk, which I feel is actually probably the most important, is our financial risk, but that's kind of closely tied in with what I'm going to call a trust risk. Will you get the end result that you're looking for? Dental implant treatment is really expensive, and I was speaking with another clinician. He's got loads of dental practices and he does a lot of implant treatment like us. And we agreed that once or twice a year, we'll get somebody who, no matter how hard we try, we're not going to be able to achieve their expectations. So in these situations, I feel it's a trust thing. Our patients have put a massive amount of trust in us, but we've not been able to hit that expectation. So let's look at the short-term risks. And a lot of people will associate a risk of infection with dental implant treatment. And although infection is possible, I'm going to say it's kind of rare. And it's rare for a number of reasons. Number one, the way that we do dental implant treatment, and we've been doing it a long time, we have learnt from mistakes over the years, we'll give antibiotics before and after the treatment. And usually that covers us. There are situations where we've had infections, and almost all of them have been, number one, quite minor, but secondly, they've been in situations where the patient has decided not to take the antibiotics. And that might be for personal reasons, they're just against antibiotics, but for whatever reason, they've not taken the antibiotics before or after treatment, and I feel this does increase our risk of infections. Sometimes this means an implant will fail completely, but sometimes it means that we just got a little bit of an infection that can be cleared up using other methods. But for me, I'd say the biggest short-term risk is this implant not integrating. Okay, and integrating is the word that we use when we're trying to describe this implant in bone fusing to the bone. Okay, it's a healing process that happens around the implant, and there are certain situations where this healing process doesn't work. More often than not, it's when we're trying to do too many things at once. So in a lot of situations, our patients might not need just an implant. Maybe we need to consider a bone graft at the same time, or a connective tissue graft, or maybe we're going to put a temporary tooth on that implant on the same day as putting the implant in. Okay, this increases our complexity of treatment, but it also increases our risk slightly. I had a patient a few years ago who was really open about why his implant failed, and the reason was we put the implant in. He wanted a temporary tooth on the implant. He promised that he wouldn't bite on it because it's really delicate in the early days, but he did forget about it and he ate a baguette, the thing moved, we lost the implant and we lost the bone graft, and we were back to square one. So really, a lot of this is going to depend, number one, on the skill of the clinician and the experience of your clinician. They'll be able to guide you on what is risky and what is not risky. Let's take a treatment like All-on-4, where we replace a full set of teeth. So in a lot of situations, we'll take teeth out, put implants in, remove the infections, and put temporary teeth on those implants. And I think that's perfectly safe and reasonable in a lot of cases. However, sometimes we'll say, look, it's because of your individual situation, I feel it's a little bit risky doing this. So let's just take your teeth out. Okay, you're going to hate me for a few months because we're going to go into a denture, and then we can rebuild and put implants in. So it's very patient specific, and these videos are all very generic, which is why I always mention, see a clinician who is experienced in all of these, and they can give you much better, much more personal, tailored advice. But in general, I'm going to say the more complicated we make things, the more chances that there are of initial failures, short-term failures. So if your situation, you need a bone graft and a tissue graft and an implant, sometimes it's better to do these things separately. Okay, not always, but sometimes it is. But there's a whole bunch of common things which will happen after dental implant treatments, okay? And these aren't really risks. These are just more things to expect. Swelling, bruising, sometimes a bit of pain and discomfort, but usually you can just manage this with over-the-counter painkillers. Even when we do a full mouth, quite often our patients will be swollen, they'll have black eyes, and it will look terrible, but they'll tell me they only needed to take maybe 1 or 2 painkillers the day after. It really doesn't hurt that much in the vast majority of cases. But let's say we've got over the initial healing phase. What's next? After a few months, after a few years, are these implants immune? Well, truth is they're not. They do need care and maintenance, just like your natural teeth. So good, effective cleaning, but definitely don't go over the top with water picks and things like that. Dental implants are susceptible to gum disease, okay? And this is quite often the reason that a lot of patients need dental implants to begin with. So we know that at the patient level, they're susceptible to gum disease, and the dental implants are therefore also susceptible. This risk can be mitigated by just effective cleaning, seeing your dental hygienist, and also having the dental implant placed by an experienced clinician. Okay, this is really important because the placement of this dental implant, even like 0.5 millimeter either way, can affect how much good quality gum we have around this implant, and therefore how protected is the implant from the bacteria in your mouth. And everybody has these bacteria. Also, the design of what we call the prosthetics, the teeth over the top, this has a massive effect on how cleanable the gum is around the implants. So we do sometimes, unfortunately, see designs of the prosthetics, the teeth, which are impossible to clean under, and this will cause implant failure, but this implant failure will be 4, 5, 6 years down the line. This is another reason to have your review appointments and your general checkups at the clinic who did the dental implant treatment. At least you're keeping an eye on things, and there's a level of responsibility from the actual clinic themselves. I'm not saying that every clinic should put right everything that's happened, 10, 15 years beyond, but there is an incentive. If I'm seeing a patient for dental treatment and I'm going to be taking care of them long term, there is a massive incentive for me to make sure that these dental implants don't have any problems. We can't guarantee it. Even a place like us, when we've been doing implants for so many years, we will still get short and long-term failures. But I think the key is to have processes to minimize these failures. So what about the other one, the financial and the trust failure? This is where you have a picture in your head of what your life is going to be like after you have this complicated dental treatment. But for whatever reason, that objective has not been hit. And for some people, this could be, I'll give you real life examples, where the fit surface, the inside surface of the teeth, the shape of that wasn't what the patient expected. It changed her speech. And even though this is something which we talk about very openly before starting treatment, until you have treatment, you don't know. Okay? You don't know what that end result is going to be like. And for a lot of people, this may not be a big deal. In fact, I know for the vast majority of people, this is not a big deal. But for some people, something which we just can't even discuss or talk about is going to end up in a disappointment. And the truth is, all of our patients are rational patients. Sometimes we see people who we just know we're not a good fit. And even though they are prepared to spend a lot of money and have treatment done with us, we'll say, look, no, I don't think we're a good fit. Maybe their expectations are unrealistic. However, the patients who I'm talking to you about, the real life stories where we haven't been able to achieve everything that they wanted, these have been sane, normal people who at the beginning of treatment, they completely understand everything, and it's impossible for us to tell them how everything is going to feel. The aesthetics are often quite changeable. You know, we've got processes in order to make sure that the patient gets exactly what they're expecting in terms of the aesthetics, but it's usually something beyond that. Now, for me, this is the most disappointing failure. Everything else I can put right. We can do more treatment, we can put things right, but there's some situations where I feel that the trust has broken down and we can't put things right. And as a clinician, this is the most heartbreaking failure that we can get. Luckily, it's the rarest, okay? And as I say, maybe once a year, maybe once every 2 years, we might have something that falls into this category. So if you're going to spend a load of time and money on dental implant treatment, how long is it going to last? Well, luckily enough, we have a video all about this, and it's next up in our series.